So let's go ahead and get started. So I want to welcome you all today. So good morning, everyone. Thank you for joining us. My name is Kyle Shavasta, and on behalf of my colleagues at the Policy Impact Project, I just want to welcome you to today's session. The Policy Impact Project is a venture of the Policy and Analytics Center at the A.J. Drexel Autism Institute. Our core mission is to use research findings to propel systems-level policy solutions that ultimately improve the lives of autistic people and those with developmental disabilities. Today's webinar, Research and Policies on Urban Planning for Autistic-Friendly Cities, focuses on how we can use evidence to build more inclusive urban environments. We are thrilled to be joined by our guest speakers today, Dr. Gala Korniyenko and Dr. Wainesten Silva. But before I hand it over to our speakers, I just want to go over some quick house rules for accessibility and ensure a smooth session. So captions are located below. You can just click the CC icon or button so you can have captions going during this presentation. There is opportunity for questions. Please put all of your questions in the Q&A button below as well. We'll have time to read and answer those at the end of this presentation. And please keep it to the question format. So ask it as a question, not a statement if possible. The chat, we ask that you keep the general chat clear so everyone can focus on the presentations. If you do need tech support, please message myself or my colleague Liza, who is here with me as well. Finally, yes, we are recording the session, and the video and all resources will be shared on the Policy Impact Project website, as well as a follow-up email. In that email, there'll be the recording as well as resources the speakers will provide to us as well. So with that, I would like to hand it over to Dr. Wainesten Silva.
Well, thank you, Kyle. Thank you, everyone that is with us today. And it's a great pleasure having Dr. Korniyenko today to discuss about uh, urban planning and autism. We have partnership in this field of research, and we are working together um, for 5 years. And I think uh, we can share our experiences in research to support and improve life quality of autistic people. So thank you, Dr. Korniyenko, for being here with us today. And as a guide research, uh, as a question to guide our presentation today, uh, I'm going to ask you, why does urban planning matter for autism? And you share with us some presentation, and I'm going to share with our audience right now. Thank you.
Hello, everyone. Thank you for introduction. Today, we will be exploring the intersection of urban or city planning and autism, topic that both urgent and underexplored in mainstream planning practice. As cities grow more complex, the question of who those cities are designed for becomes even more pressing. This presentation brings together research, policy analysis, and lived experiences to argue that autistic-friendly design is not niche accommodation. It's a civil right imperative and mark of good planning. So my name is Gala Korniyenko. I am Director of Research and Development at the National Youth Advocate Program and a lecturer at Ohio State University, Knowlton School of Architecture. My research sits at the nexus of urban design, neuroscience, inclusive public participation, and a specific focus on autism. Today, joining me, Dr. Wainesten Camargo da Silva from University of Tocantins in Brazil, bringing comparative international perspective of on neurodivergent inclusive planning and policy. Together, we have been working on bringing autistic-friendly planning framework and guidelines that translate autistic lived experiences into actionable planning tools to the international sphere. Knowlton work has been recognized by American Planning Association and is freely available to practitioners worldwide, and links will be added to this presentation and on the website. Here is the roadmap of what we will cover today. So we will answer the question that Dr. Weinstein posed, why planning matters for autism. We will talk about lived experiences, environmental barriers. We will focus a little bit on 6 feeling frameworks that we develop at Ohio State University and mention universal design principles and limits for neurodiversity. And we'll talk about policy and planning applications as well as key takeaways and call to action. We will finish with Q&A. We will move from the theoretical and research foundations through practical framework and arrive to concrete policy recommendations. Please hold your questions till the end. Let's take a moment with this image. What you see represents collaboration of Dr. Weinstein, who was a Fulbright scholar focusing on lived reality of navigating urban spaces with sensory experiences of the world that differs from neurotypical default. Autistic adults often describe public spaces as designed to exclude, not through malice, but through ignorance of difference. This is what our research aims to address. So on this slide, you see, I just can't describe, Weinstein and me next to Buckeye. It's a Ohio State University mascot. When he visited Knowlton School of Architecture, it was still during COVID lockdown. He was very brave to come to see us when we didn't have any students on campus. And on the right, you see a cute dog that Weinstein has smiling to camera and his grandma. And this is when we were talking about this webinar. So why planning matters for autism? This is a very foundational question of this presentation and the research that we were focusing on. Autism involves differences in sensory processing, information processing, communication, and motor coordination. These differences directly shape how people navigate cities, from noise in a transit hub to the unpredictability of crowded intersections. The everyday built environment, its lighting, acoustics, spatial legibility, social density can either support or obstruct autistic adults' ability to live independently, access services, and participate in public life. According to CDC, approximately 1 in 59 individuals have been diagnosed with autism. As prevalence increases with better diagnostic tools, the gap between what autistic adults need and what cities currently provide becomes a significant equity issue. Our research at Ohio State University directly addresses this gap, drawing on focus groups, design studios, publications produced for the American Planning Association. Crucial research is critically and crucial research in landscape architecture, urban planning confirms that well-designed environments and access to nature can positively impact behavioral sensory challenges experienced by autistic people currently in built environment. Next one is the quote. Before we go further into research and what we did here at Ohio State, I want us to ground in the words of the autistic community itself. This is the citation from Jim Sinclair, written his landmark 1993 essays, Don't Mourn for Us. The tragedy is not that we are here, but that your world has no place for us to be. He was one of the earliest and most influential voices articulating what became the neurodiversity movement, idea that autism is a difference and not a deficit. This is what we see as a guide for autism inclusive planning. The problem is not autistic person, the problem is built environment. And planning has the power to change environments. That is precisely why this work matters. So next, I will focus on planning core influence areas, why autism is relevant to planning practices. So these are our core influences: housing, transportation, public places, the core of planning focus. And they are precisely where autistic adults face the greatest environmental barriers. Autistic adults experience environments differently, sensory sensitivities to sound, light, texture, anxiety triggered by unpredictability, and cognitive processing differences that make complex or ambiguous spaces harder to navigate. Thoughtful planning is not optional, it's essential for equitable access and comfort. There is also a cliff effect that we focus in this past memo, and it will be attached to the presentation. Cliff effect that planners must understand. Many autistic individuals receive support services through school system up to age 21, 22 in United States. When they age out of those services, they face adult life, housing, transit, employment, public participation, without the scaffolding that school provided. The built environment either fills that gap or deepens it. Inclusive planning ensures that autistic adults can feel connected, clear, safe, calm, free, able to retreat or feel in private. And on the right, you see the screenshot of autism planning and design guidelines that we developed through 2017-18. And these 6 conditions, which I will describe in depth shortly, from backbone of 6 feeling frameworks, a research-based tool we developed at Ohio State University to guide autism inclusive design. One of the powerful insights from this framework and from universal design more broadly, that designing with autistic users produce environments that work better for everyone. Quieter, clear, more predictable spaces benefit senior caregivers, people in anxiety, tourists, children, among many others. However, this is a critical point we will return to. The notion "it benefits everyone" argument can be double-edged sword. Disability community has rightly noted that accommodations should not need to justify themselves by appealing to neurotypical benefit. Rights are rights. So what are the laws and regulations exist out there? Let's look at current legal landscape. What does United States law actually require in terms of built environment accessibility? This list of laws that probably known for people who are listening to this webinar: ADA, that requires accessible public common areas; Fair Housing Act, Section 504, accessibility requirements, federal found in housing; building codes in each state, different; Architecture Barrier Act, and transportation accessibility. Here is a critical gap. There are no federal autism-specific built environment regulations in the United States. Autism is not addressed explicitly in ADA technical standards, Fair Housing Act design requirements, or federal building codes. These frameworks primarily address mobility. It's based on history, how this legislation was developed. Vision and hearing, not so much sensory processing, cognitive accessibility, or neurodivergent needs. It's not a minor oversight. It presents fundamental regulatory gap in how we define accessibility at the federal level. So these are some of the design frameworks. They are not regulatory. In the absence of regulation, field of architecture, planning, design produce several voluntarily evidence-based design frameworks. These are not law, but they're increasingly influential in practice. The first one aspect, autism aspects, design index developed by Dr. Magda Mustafa. This is the first evidence-based design guideline specifically for autistic users. Its 7 principles include acoustics, spatial sequencing, escape spaces, compartmentalization, transition design, sensory zoning, and safety. And I had the privilege to present together with Dr. Mustafa at the Royal Town Planning Institute webinar. The next one is 6 feeling frameworks, our frameworks developed here at Ohio State University that translate autistic adults' lived experience into 6 conditions that guide inclusive environmental design. We also have practical planning memo freely available through American Plan Association that provides recommendations for planners and designers that we will add to this presentation at the end. And autistic space. This is 2023 framework published in the British Journal of Hospital Medicine, extending neurodivergent inclusive design principles in healthcare settings. What these frameworks share is an evidence base rooted in autistic community experience, and what they lack is the force of regulation. Embedded them in policy and code is the next frontier. The next, we will focus on heart of our research methodology, lived experience. The insights that shaped our framework did not emerge from theory alone. They emerge from direct, sustained engagement with autistic adults. This section examines how environmental barriers were identified, named, translated into actionable planning guidelines through community-based methods. So these are major research approach that focus on 5 interconnected pillars. We were centering autistic lived experience. Autistic adults were engaged as co-researchers through focus group, design charrette, national survey. Planning insights emerged directly from their sensory, cognitive, social experience, not from assumptions about their needs. Participants described recurring environmental barriers such as noise, lighting, unclear wayfinding, crowded rooms, unpredictable transitions. These barriers surface through facilitated discussion, transcripts, and charrette interactions. Autistic adults helped shape and refine 6 feeling frameworks, clarifying how barriers to feel clear, calm, safe, private, free, and connected directly limit the ability to participate in the planning process. Survey findings confirm that sensory predictability, clear expectations, social comfort are decisive factor in whether autistic adults feel able to engage in public process. Participation is fundamental environmental, not just procedural. And the community identified practical interventions, retreat spaces, modifiable laws, lighting, clear communication formats, familiar support people, wayfinding aids. And this is directly what formed our design guidelines published in 2018. These are the images, show the community research process in action. You could see autistic adults sitting at the charrette event, students and planning researchers working together in design studios and on-campus charrettes. What important is notice here who is in the room and in the design process. This is not researchers designing for community from the distance. This is collaborative, participatory design where autistic adults are authorities of their own experience. Now we arrive to the core contribution of this research, 6 feeling framework for autistic-friendly cities. This framework emerged from years of community-based research, started in 2017, and represents first planning-specific tool that translates autistic lived experience into measurable environmental criteria. The 6 feeling framework identifies 6 effective conditions or feelings that autistic adults identified as essential to their ability to participate and navigate in urban city life. They are not abstract ideas, they're environmental and procedural conditions that can be designed for, assessed, and regulated. Let me walk through each of them. So feeling clear. reduce cognitive load. Spaces and processes must be intelligible and predictable layouts, jargon-free communication, clear wayfinding. Feeling clear emerged as one of the most important conditions, enabling autistic adults to understand expectations and participate confidently. Feeling calm supports sensory regulation. Lighting, noise levels, crowding strongly affect autistic adults' ability to use public spaces. Sensory responsive environments, such as quiet rooms, adjustable lighting, reduce echo, help mitigate overwhelm and promote calm. Feeling safe, reduce risk, and promote predictability. Safety includes not only physical protection, but also predictability in transitions, clear exits, environments that avoid sudden sensory changes. Survey respondents rated feeling safe one of the strongest indication of inclusion. Feeling private. Offer boundaries and retreat options, opportunities to withdraw without stigma, retreat rooms, low stimulus zones, support emotional regulation and autonomy, especially during public meetings or crowded events. Feeling free, enable autonomy and choice, supported through flexible participation formats, written, verbal, asynchronous, options for pacing, self-directed engagement, preferences repeatedly emphasized in our focus groups. And feeling connected, that arise from familiarity, trusted support people, environments that reduce social ambiguity. Social familiarity was the highest priority accommodation for many autistic adults. Together, these 6 conditions serve as a bridge between lived experience and planning practice, turning effective needs into accessible, designable criteria for public spaces, transit systems, housing, and participation process. The next one is our design process. This is the trial rendering. You see 6 feeling framework applied in practice on campus. We are testing design features directly to Ohio State University campus. The rendering on the right shows multi-use trail design from our work, example of tactical urbanism that applies sensory responsive principles to outdoor mobility infrastructure. This kind of participatory test and iterate process is what distinguishes community co-design guidelines from purely top design standards. Next one example is soothing space on campus. This image shows participants testing what we called soothing space, a designated retreat area on campus designed to support sensory regulation. Soothing space, one of the most direct expression of feeling private and feeling calm principles, allows users to step away from sensory overload without stigma, recharge, and return to public life when ready. This is not clinical or therapeutic space. It's a piece of public infrastructure, as ordinary and necessary as bench or water fountain. Next one is the universal design, strengths and limits for diversity. As you know, universal design, dominant framework in accessible architecture, and examines both values and limitations for neurodiversity. This is based on research I was doing a couple of years ago. Universal design that aims to create an environment usable by all people to the greatest extent possible without need for adaptation or specialized design was very transformative for physical accessibility. My chapter, Universal Design and Inclusive Participation, examines where these principles succeeded and where they fall short for cognitive and sensory diversity. The EDA includes some communication requirements, but these are not specific to autism. Universal design framework have historically been focused on physical and sensory disabilities, mobility, vision, hearing, then on cognitive process and social needs. Next one is comparison table, and I can share the article for those who want to read in detail. Shows where physical and cognitive sensory need intersect with universal design principles. The last section that we have policy and planning application. Next one. Next slide. And what would it look like to embed this principle in actual policy and planning process? Here, 5 policy priorities that we identify with Dr. Weinstein. Integrate sensory responsive standards into municipal codes. Adopt zoning, design, and building standards that incorporate sensory predictability, clear wayfinding, retreat spaces, noise, light controls to reduce barriers to public buildings, transit, and community facilities. Embed the 6 feeling framework into planning process. Use clear, calm, safe, private, feel connected as evaluation criteria for site plans, public engagement, capital improvement projects. Ensure that autistic inclusive design is measured, not assumed. Update state local participation policy to require flexible communication formats, predictable meeting structures, sensory accommodations, and options for asynchronous engagement so autistic residents can meaningfully participate. Formalize advisory boards, standing committees, and compensated roles for autistic adults and caregivers to ensure lived experiences inform planning decision from agenda setting through implementation. And improve cross-sector alignment in housing, transit, and public health. Apply autistic inclusive design guidelines across housing development, transit agencies, parks, public health programs to address the widespread environmental barriers identified by community research. None of these recommendations requires waiting for federal law to change. Municipalities, planning departments, individual planners can begin implementing them today. So what are the key takeaways and call to action? As we close our presentation, I want to distill the most important messages and offer direct call to action to everyone in this room and beyond. So the 3 core messages: lived experience must drive planning. Autistic adults understand environment barriers best. Their insights reveal how sensory, cognitive, social conditions shape access and participation. Centering their lived experience through focus group, charrette, survey, and compensated advisory roles must become standard in planning, not an add-on. The 6 feeling provide a practical blueprint. Clear, calm, safe, private, free, and connected are not abstract ideas. They are measurable environmental procedural conditions. This framework translates autistic experience into designable planning criteria that any practitioner can use. And it's not the only framework. There are others and design guidelines that exist out there. And planners must redesign environments, not people. Environmental barriers, not individual deficit, limit participation. Planners should implement sensory responsive design, flexible communication formats, predictable structures to create genuinely inclusive public realms and civic process. The burden of accommodation must shift from the individual to the institution. So thank you so much for your time and attention. We hope this presentation offered both conceptual framework and practical tools you can carry back to your work. We are committed to making our research freely available. The Autism Planning Design and 6 Feeling Framework and the process how we did it accessible through American Planning Association at Ohio State University. Links would be shared in the follow-up materials. We warmly welcome your questions, critiques, stories from your own practice, and the most important conversation often happen in Q&A section. Thank you. Yeah, these are our emails to share, Dr. Weinstein and mine.
Thank you. Oh, go ahead.
Thank you. Thank you so much for your presentation, Dr. Korniyenko. I think now Liza is gonna help us with the Q&A. Thank you. Thank you so much for you and all the audience that is with us today.
Yes, thank you so much for that incredible presentation on such an important topic. So we will ask that you post your questions in the Q&A box, and then I will read them out loud as they come in. And if we run out of time and we don't get to your question, we can ask the presenters if they would be willing to answer your questions after the fact, and we can send out responses via email if that works.
Thank you, Liza. And while the audience warms up and gets your questions ready, we encourage you to put your thinking hats on and ask any questions you may have. But I have an opening question. Have you seen any examples of urban planning across the world? Are there any cities that have done a good job that you can point to and say they get it?
So I am collaborating with Florida organization. It's called Happy, Helping Autistic Adults Access and Perform. So I'm on the Workforce Development Board, and they actually designate certain cities in Florida, autism-friendly cities. They work directly with the mayor of one of the cities. You can Google the name of the city and do training and assess the city for being autism inclusive. The article I attached for this presentation and you would share on your website, I did with my friend Alex Pisha. He's landscape architect and a planner. We took our feeling frameworks and looked through the experience that he had doing landscape projects, public spaces, parks, and show exact examples with the names of the project that highlight each of those feeling frameworks that you can look through. And maybe you will notice something that's already can be marked as autism-friendly park or space.
Thank you for that. Liza, do we have any questions in the Q&A?
Yes. So one question in the Q&A is, what stops? What is the biggest barrier stopping urban transport planners taking into account the lived experience of persons with disabilities into consideration?
So based on the dissertation research that I was doing, I was interviewing practicing planners and asking them more general questions, how they include people with disabilities into planning process. So the first response kind of comes from the planning understanding of the issue. They would say, we include people with disabilities when it's disability directly focus project. For example, there was one example from Arizona when they were doing bus stops adjacent to disabled community center, let's say. So they know that they have to directly involve people with disabilities. So it's like a kind of very narrow view of participation and design. Why not include people with disabilities in every project you do, not necessarily focused on disability center. And maybe more than half of my respondents, planners that I interviewed, like 15, would think about autism if they have personal connection. They have grandson with autism, or they know someone with autism, or they watch all of the now popular TV shows that talk about autism and get educated. I had one planner that said, I watch all of the autism related TV shows. That's why I know about this. And I can see how some planning meetings would be overwhelming if it's a big room. So transportation engineers probably need to think broader and more from human experience than only technical and design principles.
Thank you so much, Dr. Korniyenko. We have a couple more questions coming into the chat. So the next question, Was there work examining light/color in spaces?
Yes. So the example I was giving, the crossing, that's why we were using this magenta kind of color. This is how we came from our focus group and charrette. So we were doing this tactical urbanism, like putting the lines to kind of different lights because we heard from some autistic adults how the designing of like spaces where you walk, like the colors that I used were like triggering. But the major complexity is autism as a spectrum, and everybody experience and have sensory differences, like experience environment differently. So it has to be tested in the actual space. What we also noticed when we were designing pick up, drop off areas on campus, designated areas. This also came from focus group. Similarly, that probably in airports, pick up, drop off areas, it's very clear where it is. So we were testing that, having like these blocks, very yellowish color that you can recognize them to reduce confusion and improve wayfinding. Those are the examples that I can think of, but probably there are more out there.
Next question from the chat. Are there any reports or resources that show the cost saving of universal design or cost in general?
Yes, there are. And when we were working last year with actual project affordable housing for autistic and other disabilities housing here in Dublin, Ohio, we were looking specifically on financing of that project. It's also available on Knowlton website. And what we know from people who oversee design and regulations, retrofitting is always cost more than actually planning from the beginning, involving people so you don't have to redo things. So being conscious of how you design things, co-designing as I was showing here, is saving money actually.
Thank you so much. We have a few more questions coming in. Making this more directly relevant to my work as a social worker, I imagine parents benefiting from this information in planning their home spaces. Do you know of anyone doing that type of work or public school design?
Yes, a couple of years ago, I presented at American Planning Association National Planning Conference with two architects. And I can share after this the names and the links where they're talking. There was a New York City architect who actually designed school with neurodiversity in mind. And they were presenting their work, actual schools that they already developed, including those guidelines and recommendations that I was mentioning. So the work is slowly progressing in some of the places when people are like consciously look at co-designing principles and want to explore something new in architecture and design. So I can give examples of those projects that are already underway. And there is actually American Planning Association has different chapters. There is specifically designed chapter that focus on schools, public schools. I think you can join even not being a planner and even look at the website. They provide materials, what they actually do in terms of planning in schools and school environments.
Thank you so much for answering that question. They just keep pouring in, which is great. Next question. What do we need to change in the procurement requirements or standards or urban planning processes, academic curricula, to change planning processes to being more human-centric and thus disability-centric too? Do we need to change to drive systemic change?
Yes, and this is what we were wanted to highlight with Dr. Weinstein in our 3 core messages at the end of the presentation, that lived experience must drive planning. And planning theory and practice already talks planning with, not for, meaning that you are collaborating with people with lived experience. It's already a shift happening in medical field and health field when doctors include patient experiences, and it's becoming more collaborative engagement than top-down expert knows it all kind of experience. And also the message that we wanted to highlight, the planners must redesign environments, not the people. And I remember I was taking one class in graduate school here from speech language pathology, because it was the only autism focus class that I could take from speech language pathology. I was the only planner in the room, and I looked like elephant. Everybody was wondering why I'm there. And I said, this is what I'm focusing. I'm focusing on urban environment instead of focusing on medical aspect. Although it's also important, and I'm not minimizing the great work that those colleagues are doing in autism field.
Thank you. And you alluded to some of the questions that we had potentially ready to go for you on our end. And so, if we wanted to start small, what is one simple change we could make to our city's public parks or sidewalks tomorrow to make them more sensory friendly?
So one example could be create don't bother me zones. And we were talking in our focus group. This is what autistic adults were talking, said, don't bother me zone. I need don't bother me zone. It's a small defined pocket of green space set slightly apart from high traffic areas, for example, with seating, natural elements, plants, shade, and clear sight lines so users can feel neither trapped nor exposed. This single intervention directly addresses feeling of calm, privacy, and safety simultaneously. It benefits broader community too, without needing to justify it only on that basis. And as research emphasizes, accommodations don't need to just benefit everyone to be worth doing. So while traveling last year from transportation conference in Portland, Oregon, for example, airport, I saw first time ever sensory design room. It was amazing. I could go there, experience where you can modify light. You have steaming toys. You can modify also temperature in that room. It's a great way to just designate one of your spaces to those kind of don't bother me zones. You don't have to, put a lot of resources into build something separately. You can already use those things. And also I attach our article and heard voices, University Neurodiversity in Urban Environment from Ground Up journal we published with my friend from landscape perspective. There are examples that you already can see exist in the public spaces.
And yes, I would love that don't bother me spaces sometimes too, for sure, as one of our audience members commented. How could someone use the 6 feelings idea at home or when they go to the grocery store to help feel more calm and in control?
So the 6 feeling framework can work as a personal environment and checklist, a way to name and then address what is dysregulating you in the space. For example, Feeling safe at the grocery store. Choose lower traffic times, early morning, weekday afternoons. You already know certain grocery stores and public spaces, movie theater, designate, or like our Columbus Zoo, designate certain days for autistic children, for example. Or you can have designated movie theaters like showing certain movies with a sensory sensitivity. Or use a car to create small physical buffer. From my survey of autistic adults, they were using actually dog to create this buffer, like support dog. In home, you can identify one room or corner that reliably feels safe, and you return there when you're overwhelmed. Use noise canceling earbuds in loud stores. This is one of the feeling calms, and this is how we had autistic people participating in our charrette, having ear canceling devices. And home, you can reduce fluorescent or flickering lighting with warmer bulbs and lamps. To be able to feel clear, make a grocery list organized by store layout so navigation feels predictable, for example. Clear visual clutter from at least one area at home and create low stimulation anchor space. Feeling connected, you can go with trusted person who knows your needs or use familiar route through the store, for example. At home, you have designated landing zone, return as a grounding ritual. Feeling private, you can use self-checkout, for example, to reduce social pressure. And now those options exist in some grocery stores. At home, maybe you can designate personal space and other knows that it's don't bother you or don't interrupt your zone. And feeling free, you can think about your exit options in a store, stay near the aisle, and gives you a sense of non-entrapment. At home, avoid arranging furniture in ways that it blocks sides, lines to exit. This is just thinking how you can apply this framework that we were thinking when we were designing it. I'm not an interior designer. You can think about it and maybe have, spend time to figuring out how you feel in certain space. Because our research framework shows that autistic adults spend so long masking what they don't let other feelings to be expressed, and some of them missing this out. So using this feeling frameworks assessment help them to name the problem before solving it, right? To identify it.
Yeah, and those are some really great suggestions that hopefully people can apply at home and in their communities. Thank you so much. Another question that we have, how can policymakers authentically work with autistic people and their families when designing policy that impacts built spaces?
That's a great question. My dissertation research points to several concrete specific principles. Signal inclusion before the meeting, not during it. Proactively disclose accommodations in event announcements, like quiet rooms, flexible participation formats, hiring loops. So autistic people don't need to identify themselves or make special requests. The act of naming these accommodations signals that you belong to this room, and you don't require people to call ahead of time and ask for those accommodations. Diversify what participation means. Verbal public comments at a loud gymnasium is one of the least accessible format possible. And this is where a lot of planning meetings and design charrettes are happening. Surveys, written submissions, online participation, small groups, as we used in developing our framework, all expand who can meaningfully contribute. And COVID era planning showed us flexibility is achievable. Why we suddenly forget about it? This meeting wouldn't be possible if we didn't have Zoom and having connected with Weinstein when he's been in Brazil and me being in Ohio. Work through trusted organization, not checkboxes. Even the feeling frameworks is succinct, feeling framework. it's not and. You can develop your own kind of workflow. Rather than tokenistic representation, build outgoing relationship with disability organization the way planners already do with neighborhood association or cultural committees. My collaboration with Autism Living back in the days, now it's all in, at Ohio State was this model: sustained, community embedded, not extractive. This collaboration started in 2017. Next year will be 10 years. And because I'm still working at Knowlton School, we were able to collaborate last semester on actual project with All In doing site assessment for their new housing development. And also include autistic planners and professionals. My participation in San Francisco chapter of American Plan Association a couple of years ago was illustrative of that principle. Planners, autistic planners who were doing their master thesis using our 6 feeling frameworks, were with lived experience, bringing knowledge, no literature review can replicate. And hiring practices themselves need to be redesigned. How we are rethinking interviews, open plan offices, disclosure pressures before that expertise can even enter the room. That was the highlight of our work when we had autistic planners talking to other planners from planning perspective and autistic perspective during that meeting, using the 6 feeling framework and seeing how it resonates with them. And also frame it as a civil rights obligation, not just cost-benefit calculation. As I have already noted, requiring that accommodation benefits everyone before implemented is a form of exclusion. Policy covers conversation about disability belong to rights framework.
Thank you so much for that. Those are some great ways to sort of improve design for this population. And we have another question in the chat. What efforts did you make to ensure that the focus groups and design charrettes were accessible enough to achieve representative participation? I ask because, as I understand it, there are often multiple barriers in co-design and data collection methods in planning and architecture, which can create additional obstacles for participants.
Yes. So we were lucky to collaborate with autistic organization who came to us and said, we need this. What is there that addresses autistic experiences planning? So we were working through autistic organization, right? So we had this kind of connecting body. And we were actually doing first focus group at the office with help of Dr. Amiga. It was his practice where he works with autistic adults. And he was, in a way, gatekeeper and protector of their rights. So one of the examples, he was so overprotective of his clients. We had to do focus group with autistic adults at his office. And because he wanted to ensure anonymity, we had to hire court interpreter. So we had to have additional funds to hire a court interpreter that would transcribe, removing all, because Dr. Amiga didn't even wanted to use, our devices, recording anything and even like removing certain. No, he wanted that person to be there and at the real-time process, remove all of the identifying information. So for some, it could be a barrier, but if you are collaborating and work through autistic organization who are protectors of the right, in our case, it was Dr. Amigo who brought us to the place where people are and planning already doing that, meeting community where they are, not like bringing them to planning office. And that would help to eliminate those barriers that commenter was mentioning.
Yes, and meeting community members where they are is also a concept that we talk about a lot in public health and in research and policy. So thank you for offering that perspective. We have another question in the chat, and I'm noting that we are 5 minutes away from our designated end time. What are the prospects of persons with disabilities becoming trained and getting a job as urban planners?
So there is guidelines that exist for every public university because they're getting federal money. They cannot discriminate. I had and continue to have planners who are autistic, identify as such, and diagnosed. So I attached to this presentation link that I did a podcast, how to make planning more neurodiverse inclusive, and also publish blog on American Plan Association, how planning offices should hire neurodiverse planners to make the profession more inclusive. I think it's so also very similar in medical profession and health profession. How many doctors we have with actual disabilities, and it's changing. So we want also to make sure we're changing planning profession as well.
Thank you. I don't see any more questions coming in. Wainesten, did you have any questions or points that you wanted to contribute?
No, thank you. Thank you so much for all the audience, all the team that supported this section, and our thank you to Dr. Korniyenko that shared her knowledge with us today. So that's all. Thank you. Thank you so much.
Wonderful. Thank you, Liza, for closing us out with those audience questions. And thank you, Dr. Korniyenko and Dr. Silva. To our audience, as a reminder, we will be providing a follow-up email with resources related to this presentation, as well as a link to the presentation itself. Our goal is to get the presentation up on the Policy Impact Project's website within a week, along with links to the various resources. Processing time may be slightly delayed, but stay tuned and we'll have all that information out to you all shortly. Thank you, everyone, for this wonderful presentation.
Thank you. Thank you, Policy Impact Project, Kyle and Lisa and Wainesten, and thank you all for doing this.
Absolutely. Thank you. And everyone have a good day. Take care.